Hey y'all, welcome back to another Nurse Chats with Christy May. I'm currently on lunch break. It is 2:41 in the morning. I took a break a little earlier today. Um, so I just wanted to come and make a quick video about prioritization. How to prioritize as a nurse. What I've done over the past and some tips that I can give you guys to hopefully make your transition, if you're a new nurse, make your transition easier, or if you've been a nurse for a while, pick up some tips because guess what? We all learn from each other. I always say when I come to work as a nurse, I need to learn something new. And whether it be from an older nurse or a new nurse, somebody who ain't even a nurse, a patient, whomever, like you're always evolving and you're always learning. So that's the one beauty of being in nursing is that your mind always get the chance to learn if you'll receive those things. If not, you'll become stagnant and then you'll be a bitter Becky. Let's be 100, but that's a whole nother subject. We ain't even talking about that today. We are talking about how to prioritize as a new grad nurse. So the first thing, and I know you probably learned this in nursing school, and everybody always emphasized like when you come in, you get your patient assignment, you always do like ABC, which is airway, breathing, circulation. So you want to see those patients first in that particular order. If you're in the ED, like me being an ED nurse, is depending on what part of the ED you're in, you might just do a quick 3-minute report and go look at all your patients. Well, really should be doing that anyway. We'll get to that one, but there may not be no particular order. Or none of it's relevant, depending on, again, what portion of the ED you're in. If you're on the floor, then pretty much you can kind of see your patients by ABC. I always like to throw ABC and then safety concerns up in there too. Being a night shift nurse, when I come on, we're gonna go ahead and talk about it. Y'all make sure y'all get bedside report, or if you don't get bedside report, as soon as you get done, go look at your patients. Make sure they're breathing, for real, especially if you're not on the telemetry floor where they're not being monitored. Make sure the report that you're getting is lining up with the patient that you're looking at, because stuff happen. I mean, people can change. They can have a status change within the last 20 minutes, 30 minutes of the prior person's shift, just like in your shift. So that's why it's important to have like bedside report, or at least go look at your patient as soon as possible, preferably within the first 10 minutes, 15 minutes of you getting there. Even if you look at your patients, like sometimes I do this, I look at my patients before I even get report on them, because the other nurse may be tied up doing something else. And again, I want to make sure what you're telling me is what is laying up in the bed. And that goes with oxygen. That's checking out with oxygen at home. Just telling somebody, hello, how you doing? Introducing yourself. They'll introduce themselves back. You can test mentation. If they're up or at family in the room and they're interacting, you can assess mentation from just that simple thing. Look at what drips they're on. Look at the rate. Look how much, fluid is in the bag. Like all of that take less than 5 minutes, not even 5 minutes, 45 to 90 seconds, when you can do a quick assessment and have a baseline for that particular patient, all within the conversation. And yes, I learned this in the ED, working in the ED, triaging a lot. It teaches you to assess really quickly, because of course, like those emergencies, you want to get them to a stabilized place as soon as possible. So being able to take those skills and bring it back to the floor, I thought it would be really helpful to kind of tell you guys some of the things that I do as a prior ER nurse now on the floor. So what I mean by safety, let's say oxygen. Well, I guess oxygen I fall under like air and breathing, but safety meaning patients climbing out the bed. Yeah, you want to make sure that your patients are safe. You want to make sure that you're safe. Like if your patient cut the food, do they need to be chemically restrained? Are they hungry? Are they sundown? And do you need to call a family member? You want to take care of that first. I mean, I think that's right up there with the ABCs. Yeah, you breathing, you circulating, ain't nothing else going on, but you got like a 9 o'clock med pass, whatever. But you got somebody climbing out the bed and acting crazy. Not acting crazy. Let me stop. Let me not say acting crazy, but I'm country, y'all. Can't help it. Not acting their normal selves. Let me be a little bit more professional with it, but I'm just trying to keep it 100. You definitely want to keep your patient safe, because the worst thing that can happen is your patient have a situation where they fall, break something, break multiple somethings. Like that's not good for the patient. It's going to make whatever they're admitted to your floor for, whatever type of floor you're on, it's going to make their situation worse, because not only, let's say they just came in for ablation, or they're outpatient, but they had some issues with it, and they're in the hospital. That's the only thing they're in the hospital for, or AFib, trying to get control of AFib, and now they go and have a fall. So they broke a hip. So now they got this extensive surgery that they gotta do, rehab, like something that they didn't even have to worry about prior to them getting admitted for a cardiac related issue. So that's why I say safety is like so important. So you need to call the doc, get some help from your teammate, your charge nurses, your supervisors, or I always call it family. A lot of times that help. Now that we're kind of getting out of COVID, and I know here in South and North Carolina, hospitals are allowing people to stay overnight now. So that's helpful now when if patients can come and stay with confused patients, because it happens, especially, on a full moon. So that's really helpful. I'm glancing down because I did write a little bit of things while I was eating my food. I meant to eat with y'all, but I forgot. I'll eat with y'all next week to share my lunch or whatever. It was the same thing because I just ate whatever I had left from last night. I think I talked about the rest of this stuff. Like whenever you're rounding, just look at your patient really quickly, just assess them. It don't have to be anything extensive, because when you come back around to do your pills, pass your meds, you do your assessment at that particular point. So yeah, so if you're a new grad nurse, it'll take a while to get, not a while, however long it take you. Like if it take you a while, that's fine, as long as you get your own rhythm. And you will get your rhythm, but prioritization to different people means different stuff. My thing is always go by the ABCs and safety concerns. That's like your most important thing. If somebody's supposed to be, having a medicine, a drip that they need, go start that drip. Don't be fussing, don't talk. And I know like you want to like chit chat with your coworkers, whatever the case may be, but if your patients ain't good, then you ain't good. And that can really affect their safety as to why they admitted to the hospital in the first place. So, try to get those things done, prioritize that way. And that way you won't be behind. So if you happen to get admission or you have to transfer a patient, those stuff like that, you don't really have anything to do with. But if you have open rooms, which means that you're going to have an admission, you prepare for those things. And in a future video, I'll definitely get into anticipation. When you anticipate the needs of your patient, it will make your life feel so much better. You would do so much better by anticipating the needs of your patient. It's a beauty. It'll make their life better, especially if you work night shift, y'all. It's the business. You want to make sure they're comfortable, they get rest, because I'm a big advocate. Like rest is a healer of the body. So those individuals really need to get proper rest to be able to heal properly, so they can go home and don't come back in 3 days, right? That's the goal. Stay at the house. So I am so thankful that you guys stopped by again. This is just a nurse chat segment. I enjoy doing it, and I'll just share parts of my journey as it relates to nursing, and for this particular section as it relates to nursing. So I will see you guys next time. Peace and blessings.